Welcome to Unpain Clinic podcast. Here, you will learn how to resolve stubborn pain for muscles, tendons, joints, how to increase your athletic performance, optimize your biological age, and look naturally with long-lasting results. I'm your host, Uran, founder and visionary of Unpain Clinic. Stay tuned. I hope you love it. Shauna has been a physiotherapist for over 20 years, and I'm just going to share a little bit of personal story, how lucky we are to have Shauna on our team and how the hiring process went. So I remember we had the interview, and on our interview, we asked a question about plantar fasciitis. And pretty much any therapist who answers, like we ask, like, how do you treat plantar fasciitis? And any therapist, if they start talking about like local treatment of the plantar fasciitis, it's not the therapist that we're looking for. It's not our mindset. And the main reason is that we look the body as a one unit. So even though it's a plantar fasciitis problem, it doesn't mean that the problem is with the fascia or the cause. Usually the problem, it stems on the lower back or hip. So when we asked this question to Shauna, she was the first therapist that said, actually, I check the core muscles first, the hips, and check how they're working, and then I look into the plantar fascia and treat it. And that's where we actually stopped the interview, and we knew that she's the right fit. She's the same mindset. So tell me a little bit more about your experience with Unpain Clinic from the moment that you started with us doing Shockwave Therapy to today.
Thank you for those kind words, first of all. So yeah, I've been with the clinic now here for almost 10 months, and it's been an awesome experience. So just a little bit of background, I guess, about myself is I treated clinically in private practice, did a lot of sports physiotherapy for about 11 years, and then took a break from the clinical world and actually went more into the corporate world, where I was responsible for scaling an industry-leading occupational testing company's fitness for work program, which had a very heavy physiotherapy rehab medicine-based component to it. So I actually kind of went hands-off for a number of years, but during that time was heavily involved in a lot of research. And I'd always said that if I was ever to go back to clinical practice, that I feel like I would be so much more of a skilled therapist as I was 11 years prior. So fast forward to December 2019, I just made the decision to step away from the corporate world. I really missed the client setting, the one-on-one interaction. And so I knew when I wanted to go back to work, I didn't want to do traditional physio, for the reasons being that I felt like people would get better over time, but it would take them so long. And so that was one of my non-negotiables, that I wasn't going to go back to just kind of a regular physiotherapy clinic and do your assessments, your ultrasound, your TENS, your manual therapy, and your exercises. And so the company that I was working for previously, they were very, very innovative and always kind of ahead of the game. And so that's where I started researching, okay, well, kind of what's ahead of the game in the physiotherapy world. And just lo and behold, it was pretty cool. I still remember live in Edmonton. I was stopped at the train tracks on 50th Street one day, had made the decision to quit my job, and stopped at the train tracks, was not distracted driving. And I just went on Indeed.com and I saw this ad posting, and I was like, oh, for a physio, for a Shockwave Therapist. And so I immediately went home that night and researched the heck out of it, researched the heck out of Unpain Clinic to see what they were all about. And I was just said to my husband, you know what, wow, this is a real unique fit, and I think a real unique opportunity. So I applied, and here we are today. And just coming to Unpain Clinic, it was just like riding a bike. Being out of that clinical setting for 9 years, I think a big part of it as well was just the culture here at the clinic. Everybody was so welcome and so inviting. And then obviously being able to learn from the Shockwave guru yourself, Uran, I think it just really set the tone. I really felt like our treatment and our assessment styles were very similar. And so yeah, I just don't even think there's a day goes by that I don't have a research article in my hand and, just keeping learning more and more about Shockwave.
Yes.
So it's really sparked that kind of creative energy in my mind, as well as to how can, we uniquely treat these cases using Shockwave. And so my personal experience, it's been amazing. And so, treating people for 6-7 months, with traditional physiotherapy means, and then having these people who've been in chronic pain for years come in and you treat them 3 times with 1 week in between. And after their third, they're just like, I've had this breakthrough, and then calling them 4 weeks later after to check in to see how they are. And I would say probably 75 to 80% of the clients don't actually even need to come back for that 4th treatment. And these people have been in pain for months to years. And so it's just a very, very gratifying opportunity to be able to help these people and then just get them back to kind of who they were.
So for anybody who doesn't know anything about the Shockwave, this is your first time learning about it. And for anyone who had Shockwave therapy or who thought that had Shockwave therapy, today you're going to learn the difference between actually the true Shockwave and what is known in Canada as a Shockwave therapy. So Shockwave therapy, it's actually it's a sound wave. It's the same technology as they break up kidney stones with. It's been used in medicine since 80s, and since 90s they started using in orthopedic field. So orthopedic surgeons took the idea from urologists and they thought, you know what, if Shockwave can actually break down a kidney stone, why it cannot break down a calcium buildup on the shoulder? So they started their initial goal was to actually use Shockwave therapy to break down the calcium buildup. And they tried a couple treatments, and one thing that they realized is that they could not break down the calcium buildups on the shoulder. And the main reason is that the calcium buildup on the shoulder, it's actually it's still soft. I heard this from surgeons because I'm not a surgeon, but they said it's like when you touch the calcium on any joint, it's actually soft. It's almost like a toothpaste, versus a kidney stone that it's actually a solid structure. And when the sound waves actually travels through it, it starts disintegrating the stone. But what the orthopedic surgeon realized that about like 6 months later, that calcium buildup started dissolving. And that's when they realized that Shockwave actually has, or it's causing some biological stimulation in the body. And it cleared that excessive tissue in the area. And today, after almost like 30 years, we actually understand better how Shockwave therapy works. And it's actually one of the it's considered one of the most effective regenerative therapies in medicine. And it's completely non-invasive by using pure sound waves. And the main effect of the shock waves that we know are breaking down scar tissues adhesions at up to 20 centimeters deep in the body without hurting any tissue or causing any side effects, stimulating new blood vessel growth. So with a lot of modalities in rehab and medicine that we use today, they just improve current blood circulation, where the shockwave does that, but on top, it actually stimulates your body to create new capillaries in that area. So within 4 to 6 weeks after the true shockwave application, you will have 200 to 300% more blood circulation. And as a result of that, the stem cells are actually triggered and they come in and repair whatever it's injured. So it takes the highest activity of the stem cells wherever the shockwave is applied. We typically see about 8 to 10 weeks later. And the protocol is we pretty much aim for 3 sessions, 1 session a week, or minimum we say you must wait 3 days between treatments and maximum 15 days. And after 3 sessions, we suggest to wait for about 4 to 6 weeks. So, and in 6 weeks, if there is still anything, come back. If not, that's it. Who can actually get shockwave treatment? So pretty much at our clinic, at Unpain Clinic, we look for people that have been in pain for minimum 3 months and have tried everything else. And if any other form of therapies has failed, that's where we can actually help more. That's what we call it. It's our unique ability. Not that we cannot help you even before 3 months, but if there's an injury that it's small, you probably, when you go through massage, physio, chiro, that would do the trick, and you don't need us. But if you want to accelerate even that healing, we can definitely help, because shockwave, it's a regeneration therapy, and it will stimulate faster healing anytime you do it. So it doesn't really matter the time. Are you able to tell us a case that you remember right now in your head, somebody who you helped, with shockwave?
Yeah, absolutely. So I had this gentleman come in who worked in the in construction sector, and quite often our client care specialist will just kind of ask a few brief questions and leave any important notes on the appointment for us. And so this gentleman was coming in for chronic knee pain, and he was just very confused because he'd had this knee pain for years. He'd had a recent x-ray on his knee, and the doctor was like, you know what, I really haven't even seen somebody your age like have that healthy of a knee joint. So it was just really a mystery. And he had sought chiropractic treatment, traditional physio, which had focused on some IMS, a little bit of exercise. But he said, he just really hadn't had any improvements. And so fast forward to a couple months ago, he came into the clinic. And so again, looking at the entire kinetic chain, significant lumbar spine mobility issues. He had actually a hip flexion and an adductor contracture at the hip. Knee tested absolutely fine. And got in there further, and I was under the impression that he had actually had a quite progressed osteoarthritic process going on in his hip. And so I treated him. I also sent him off for some diagnostic imaging just to ensure that there wasn't anything more sinister going on in the hip, just to confirm that it was actually osteoarthritis that we were dealing with. And it came back that he had actually had moderate to severe progressed arthritis. And so we treated everything from his lats to his extensors to his adductors to right within the hip joint. We were able, like when he was actually lying supine, he had had such a hip flexure and adductor contracture that he couldn't even extend his knee on the bed. And that was forcing his spine into hyperextension when he was lying supine. He was walking like a 90-year-old man because, again, of that hip flexion contracture. And so I treated him 4 times spaced 1 week apart, just because this had been going on for several years. Followed up with him after his 4-week break, I guess. And he said his pain was markedly reduced. He was standing up straight. He was continuing to do the exercises, and we just agreed that he's going to monitor his symptoms, and then he's going to pop in for kind of a tune-up as needed. And my takeaway from that is I saw him for 4 short weeks, and I felt like if I had been treating without Shockwave, I would still be seeing him probably, once a week at least for, quite some time, up until he would potentially need surgery. And, with the biological effects that we do have with Shockwave, I'm really confident that we're going to delay that time, that he actually is going to have surgery.
Yeah. And that's the thing. It's like there are cases that probably still end up with surgery, let's say.
Mm-hmm.
But when you get a joint replacement, since we're talking about knee, and we'll take an example of a knee, when they do joint replacement, they don't replace the muscles. They don't replace the mechanism that moves that joint. Yes, they go
Mm-hmm.
and change the joint. And what happened actually after the surgery is now the muscles are injured even one more time, because
Mm-hmm.
first there was a chronic dysfunction on the muscle that actually wore out the joint. Now the muscles get cut, there's scar tissues, adhesions, and joint gets replaced, but then people still end up with different pain.
Mm-hmm.
And that's typically what I've seen personally. I don't see people who had 100% success after joint
Mm-hmm.
replacement. I do see people that didn't have success even after joint replacement, and usually this is the case. So even with the shockwave treatments that you have done, let's say, or what we do before joint replacement, you're actually taking care of the mechanism, you're taking care of the structures, you're preparing the area. And I remember I had a guy who had actually 3 joint replacements, both hips and one knee, and he was waiting for the last knee, to get replaced. And because we did shockwave therapy, or the true shockwave therapy, in combination with a radial pressure wave, uh, when he actually went through that joint replacement, he came back to me and he said, my rehab, it was at least 50% faster, like
Yes.
after this, because we have treated the area, we have triggered regeneration, activated new blood vessel growth and stem cells. So therefore shockwave can be used pretty much like before or after surgeries or joint replacement.
Mm-hmm. And another, I guess, unique experience, I guess, as well as on that plantar fascia topic. I did have a gentleman, and he was a retired urologist. So, of course, whenever you get somebody else that you're treating it in the medical field, it's like, I got to make sure I do everything right. And it was so funny. I remember after his first treatment with me, he's like, you hardly treated my foot. And I was like, you wait. I'm like, you wait. And then, so sure enough, I treated, the lower kinetic chain. His glutes were disengaged. His lats were disengaged. He had a lot of restriction in his hamstrings and his calf and his Achilles tendon. And so treated those areas, balanced him out on the front with his hip flexors as well and his core. And I called him at his 4 weeks, and he's like, I'm just walking around the golf course with no problems. He's like, I'm like amazed. He's like, you hardly treated my foot. And that's where the pain was manifesting.
Awesome.
So that was a cool
Yeah.
experience too.
I have another question for you, Shauna, because this is something that we talk about shockwave, and this is what we find with clients. If somebody comes to us for shockwave, and we actually call it, our services, we call it true shockwave, because we actually offer 2 different types of true shockwave, and then the radial pressure wave, which everybody in Canada calls it radial shockwave or shockwave therapy. So tell me a little bit about your experience. Like, how do you choose the tools? Like because I'll probably explain here. So we have the radial pressure wave, which is a kinetic pressure that breaks down scar tissues, adhesions. Then we have what the industry calls it a focal shock wave, the dual lift from stores. And then we have the flash wave, which is we brought it for the first time to North America last year from Germany. It's electrohydraulic system, and the flash wave stimulate more muscle growth.
Mm-hmm.
So what has been your experience like combining those 3 different systems when you treat?
Yeah, so I think with a lot of dysfunction, we have when one muscle group is facilitated, usually the opposing group is inhibited, and vice versa. And so if I have an area of muscle that's facilitated and overactive or hypertonic, I will generally initially start out with some radial pressure on that area. So to decrease the trigger points, and then also just to a general relaxation over the myofascia. And then depending on the size of the area that's being treated, because we know when you have overactivity in a muscle, hypertonicity, you get a metabolic crisis in there. So you're cutting off the blood supply. So then if it's kind of a smaller area, I'll get in there with the focal shockwave and do some spot treatment there. And then in the areas where we've got inhibition, I really like to use the flash wave because we know that it's been associated with muscle activation.
Yeah,
And I
that's
find the
awesome.
combination of the three works really well. And then as a physio, I am very, very pro exercise as well. So I always
Yes.
follow with
Yes.
stretching the facilitated muscles and then strengthening the inhibited muscles.
Yes. Yeah, exactly. Because in the end of the day, everything that we are doing is to actually get this client, this human back to motion. And
Right.
so we want to decrease the pain, we want to stimulate, the healing, and then have them back to the activity or their normal life as soon as possible.
Yeah.
Yeah. Okay, Shauna, this has been a great pleasure. This is being our first podcast ever, and how
Woohoo!
we so I promise from my end and probably from your end, then next time will be probably even more specific and we'll talk more in different topics. But we had a meeting last week, you and me. We're working on a shoulder presentation for the first time to put it out there. And I just said to Shauna, you know what? Let's just do a podcasting. So for people who are driving, who like just the audio, aspect of listening to this, they have the chance to listen to a podcast. But I promise to the audition or to people that we will produce more podcasts, and there's going to be a lot of values for specific conditions. And our main focus as a clinic, we focus on mostly on muscle skeletal pain, so pretty much anything that hurts from head to toe, men's health for erectile dysfunction, anti-aging, so for face treatments to actually activate the facial muscles, so it creates more volume on the face, which results then in more collagen production, skin elasticity, and decrease in wrinkles, and it just people look more rejuvenated. And athletic performance, so if there's any athlete that wants to improve their performance, these are the areas that we target. So in the future episodes, we're going to start picking, per kind of condition, and we'll break down that condition, and we'll just brainstorm how we actually treat those cases. So and like what we are saying now, since or after we're still in middle of the pandemic, but the pros of this pandemic for us in practice, it's been that now we have the ability to offer telehealth consultation for clients. So anybody that is interested, or anybody that has been in pain, let's say, shoulder, hip, knee, feet, lower back, neck, wrist, elbow, they can actually go on to our website and just book a telehealth session. It's free. Just talk to the therapist for 15-20 minutes. If we see that we can help, yes, come in. But if we see that we cannot help, that way it's more efficient for our end and for the client. So that's been great. So you have been doing more telehealth services, correct?
Yeah. Yes, I
And
have.
how
Yeah,
it's
they've been
been
great.
like, yeah.
Yeah, it's been really great. So it's great for so you get to, meet the person before they come in. So you almost feel like you've established some sort of relationship before they even come in. And then it's also really beneficial for the client as well, because when they come in and they're booked for their hour first session, because we've eliminated that interview portion over the phone, they actually get more bang for their buck, right? They're booked for an
Yes,
hour, so
yes.
we can offer more treatment to them in that initial session. So it's been really great. And I would say we have probably a 99% success rate with people actually
Yes.
booking the appointments through the telehealth. And it's been a really great experience so far.
That's awesome. That's awesome. Okay, Shauna, I think this is more than enough for our first episode, and we'll promise to people out there that we're gonna be probably at least one episode a week on different topics, and that way anybody who would like those updates, it's just going to be general conversation for mostly chronic pain or dysfunctions, and they can actually subscribe to our podcast or like our Facebook page. So because in the future we'll have even like a live probably Q&As for people where they can join and ask directly there. Okay,
Perfect.
so Shauna, thank you very much. It was a great pleasure talking to you always, and then sharing this conversation with other people.
Great. Thank you.
Thank you. Thank you.